to the fourth episode of the Niva Bupa Health Insurance Presents Times Network's Living Room Conclave India Mission Season 3, co-presented by Sensodyne. My name is Amita Vadva. Now, we have constantly heard the word digitalization of the economy, but has never pondered the interconnected streams and forgot to give due credit to digitalization of medical healthcare. COVID might have been the reason why it might have progressed at a rampant pace, but it was the choice of consumers that allowed it from keeping growing even when it comes to the country that came back to its normal routine. Technology has evolved the medical space and healthcare facilities to an extent where consumers today have access to the first line of treatment by way of online doctor consultations while also being in the comfort of their own homes. Not just that, everything from booking doctor appointment to ordering diagnostic tests, medicines, that all of them is available at the click of a button. Now, while the gap between healthcare delivery and digitization is narrowing rapidly, India still suffers from the shortage of specialist doctors for both its rural and urban population, and doctor-patient ratio in India is still less than 1 doctor every 1,000 patients. A substantial portion of India's population still lacks easy access to healthcare facilities. Hence, the need of the hour is to adopt digital technologies in the healthcare systems and to drive enhanced clinical outcomes and improve multifaceted access and delivery for patients. So, a health mission is a series of episodes that aim to inform, raise awareness of, and to educate our national audiences on essential topics that can save and protect lives through a dialogue between the leaders from the public and from the private sectors as well. So, in this special episode of the India Health Mission, we take an in-depth look at how technological advancements have revolutionized and helped accelerate medical healthcare services in India. Please allow me to welcome our esteemed panelists for discussion. Dr. Bhavtosh Mishra, Director Claims, Underwriting and Product, Niva Bupa Health Insurance. Dr. R.K. Srivastava, who is the Senior Advisor for Innovation, Public Health and Wish Foundation India, former Chairman of the Medical Council of India. And also we have Dr. Geeta Manjunath, Founder and CEO, Niramai AI in Healthcare. So, Dr. Srivastava, I want to start with you, sir. Can you please help us elaborate and understand how technological change in healthcare has actually provided opportunities to identify ways to make medical services more understandable, affordable, and accessible to the masses, sir?
Actually, it is a long history, starting somewhere from 2009 when the National Knowledge Commission was started, and now entering into 2023 when ABDM is there and the Personal Data Protection Act has been cleared. So, it is a long journey and naturally it has got hiccup in the way, but what we have seen during the COVID period, that it helps the end user to the extent that they can get medicines, they can get diagnostic at their home, they can get consultation at their home, and even in eventuality of having a small type of makeshift arrangement of ICU, that can also be provided within the home circumstances. So, access improves, understanding of the end user improves, and ultimately it is for the benefit of the masses. Whether it has been able to reach to the last mile person, that is a $1 million question, but still it has moved forward. It has solved certain problems in areas where the end user is digitally literate and where a system exists to support the various type of technological advances.
Right. Dr. Manjunath, what is your opinion? Because there are numerous evidence that digital technology is rapidly infiltrating healthcare systems, and it is also transforming how medical data is kept and shared, and how patients also engage with their health professionals, and how decision-making treatment plans and outcomes are also influenced. So I want to understand, how has telemedicine, blockchain, electronic records, or AI-enabled medical devices aided in this process's acceleration now?
Absolutely. I think digital health technologies are current and future as well, right? Healthcare is the last one getting affected with digital technologies, AI, etc., because obviously there are several, critical decisions that needs to be made just based on, healthcare data or automation. But even if a doctor is prescribing with a notepad, how is it getting transformed and transmitted to the pharma? A click from a WhatsApp, an image goes. So that everywhere, even digital, analog to digital is also becoming very, very seamless, even at the corners of the world or rural areas as well. So given that all the data is available anywhere, anytime, can be transmitted as well, what I personally feel very, very deeply about is the way AI and such digital technologies are bridging the healthcare divide that exists in our country. You talked about one doctor serving 1,000 people, 1,000 families in many cases. Yes, that is happening. Most of the expert doctors are in the cities, right? And we did see how COVID affected the rural areas, and how many people were rushed to a ICU, how many people were waiting for a oxygen concentrator, and it was really pathetic, especially in the wave 2. How do we bridge this? Can we get the expertise to the villages in a very quick way without really wanting and having the doctor move to the village? So that is where digital technologies, telehealth, everything works.
Right, ma'am. And of course, there are still challenges that still remain. But Dr. Bhavtosh, what is your opinion, especially continuing on the same topic as telemedicine and remote patient monitoring? Do you believe it has emerged as a game changer in healthcare, especially in remote areas, as Dr. Manjunath was mentioning, and especially during emergencies? COVID is something that has affected everyone, and many people opted for also teleconsultation. Are even people today looking for such services, online consultations, and how are insurance companies integrating such service as a part of their offerings, sir?
That's a very, very interesting question, and there is a very different kind of a trend we have noticed since COVID. Of course, some of these technologies we are speaking about, like telemedicine, is not very new. But what COVID did was, it enhanced and spiked the utilization of these services because of the necessary constraints that COVID brought in. However, we are witnessing a new normal, and the new normal is much higher than before. The COVID time teleconsultation usages etc. have dropped, but it is not gone back to the levels pre-COVID. It is still much higher. Now people are used to it, it brings a lot of convenience, and imagine you have access to the best of doctors across India, whereas physically it is impossible to possibly look beyond your own city for consultations etc. Now a person sitting in Delhi could consult somebody in Bangalore, Chennai or Hyderabad or wherever, or Mumbai, and that is why it is bringing a lot of convenience, and we see a lot of uptake on this one. Of course, the uptake is specifically much higher in certain specialties and a little lower in others where there is a high touch consult required. But of course, this trend is secular, it is here to stay. What has happened is, beyond telemedicine, and tele I am referring to mostly voice based, it has moved to digital consultation. There is consultation happening on chat, there is consultation happening on video, and there is of course voice based consultation that is happening. And today what is also happening is, there are multiple doctors who can come in a single forum if somebody requires a multidisciplinary consult as well. That is also being possible today.
Right, so more options, the better it is. And Dr. Srivastava, sir, especially if we talk about Ayushman Bharat digital mission. Now, this is said to be one of the most ambitious programs in the Indian healthcare ecosystem that seeks to create a single digital platform for the entire healthcare ecosystem, sir. So, the main components of ABDM are, especially if we talk about Ayushman Bharat health account and the healthcare professionals registry, HPR, or the health facility registry and the health information exchange and consent manager, sir. I want to understand how these initiatives under this digital mission can actually make healthcare accessible by combining technology and healthcare services.
It is an effort started, I think, about 5-6 years back, with a blueprint created and thereafter converted into a mission, and ultimately leading to a ABDM with 3 standard goals, so that it can integrate technology within the overall delivery system in a structured manner. The one problem which came, that was pertaining to the digital data security, has been taken care of now. So, if we look at it, what we are getting after this much time of experiencing in pilot mode and further expanding it, we have got ABHA, identifier, a number. We have got a DigiDoctor, a doctor who can be consulted through digital system. We have got a EHR, it means the record, the data, personal as well as health data are secured at a place. We have got a telemedicine with e-Sanjeevani, which can use a digital technology to provide access to those who are not able to come to the OPD, and it is running in good number of places even today. So, it is providing a platform to integrate everything. For that, the system has created certain things, just like UPI, it has created an interface. Now, it is a work in progress.
So, Dr. Bhavtosh, there has been a massive emphasis on digitization, especially with the assumption of the Bima Sugam by IRDAI to bring in fresh waves of reform in the health insurance sector, sir. So, how do you see these initiatives being beneficial for the customers, and do you believe that it will lead to greater penetration of health insurance across the country?
No, absolutely. Last year or more has been quite transformative as far as the role of regulator on insurance in general and health insurance in particular is concerned. These have been disruptive and in a very positive way. All these initiatives of reforms, so be it Bima Sugam, be it other initiatives of the regulator and policy level changes, are going directly to benefit the consumers of health insurance. One of the ways is there is going to be a unified approach, there is going to be a unified data approach as well, which will make buying and servicing of health insurance much more convenient. Of course, this directly leads to penetration of health insurance in India, and which is a very important objective. See, the regulator for insurance is the only regulator in India which has a D or a development agenda as well of the sector. No other regulator India has, and I believe that has come to fore with a lot of reforms that the regulator IRDAI has been doing in this space. Of course, this is promoting convenience to consumer, much simpler understanding of products, facilities, services, healthcare, health insurance and other related accesses. So, this is a very positive one. I would not say Bima Sugam alone is going to be helping achieve the big goal of every household with health insurance by 2047, but yes, it is instrumental, it is one of these.
Absolutely, and that's a positive outlook that we are all looking for, but for now we just have to head into a short break. Don't go anywhere, we will be right back. Welcome back to the Niva Bupa Health Insurance Presents Times Network Living Room Conclave India Health Mission Series, co-presented by Sensodyne, where we are discussing the role of technology in accelerating medical healthcare infrastructure in the country. So, Dr. Srivastava, sir, the adoption of these technologies, as you've been talking about, sir, do you believe that has the potential to increase access, quality and efficiency in healthcare in India? However, also critical to note and to ensure that technology is used in a certain way which is inclusive, that respects privacy and is also affordable to all parts of society. What role do you believe that the government plays in making all of this happen, sir?
You know, government, as far as technologies are concerned and its integration into the health system is concerned, both public and private, government has got a very clear roadmap before them. Their role is facilitatory. They are neither the funder nor the owner of the digital services. They can experiment, create models, create systems by which these technologies can be integrated. But at the end of the day, if we talk about the access, we have seen the access has improved during the period of COVID. We have also seen the efficiency of delivery of the service has also increased. Now, all these things which has happened during the pandemic when the system was overwhelming need not necessarily happen when there is non-pandemic situation. The complacency which enter into the system ultimately result in a compromised approach towards integrating all these things. So, government provides a system for it, which government is working over there, and part of it is available over there. And in due course of time, if I am asked to analyze which is the biggest challenge as far as access efficiency is concerned in the healthcare system, the biggest challenge is going to be there in the primary healthcare, which cater to about 80% of the population, which is not very robust and which is largely public funded.
Dr. Bhabtosh, for different generations, healthcare and health insurance have varied connotations. So how do you believe that individuals of various ages have reacted to this revolution? And do you believe that technological improvements have altered their opinion on health insurance? Can you highlight the use of technology which is helping customers in taking better and more informed decision when it comes to managing their health, sir?
Overall, it's fairly positive, and I would focus on different segments in a bit. But see, people who are elder, beyond 45, always felt a very strong need for health insurance, and they found it very convenient now to purchase or use their products and policies. The younger generations, traditionally what we know of, are much more digitally savvy, and they find, and they were always looking for digital means of buying, accessing, understanding, researching before a purchase. Now, both segments have benefited because of this. Also, the usage of health insurance and healthcare has been facilitated in a very meaningful manner. For example, at Niva Bupa, we surface the provider or the hospital ratings, including quality parameters, on our website and mobile app. Now, digitally today, we see more than 80,000 people visit these and look for which is the right provider for me for this disease or this treatment. Now, that facilitation has come purely because of digital adoption. Younger generation is finding some features in products. In some of our products, we offer unlimited tele and digital consultations through mobile app, and that the younger generation is finding more value in a traditional health insurance product, which were traditionally, let's say, hospitalization centric so far. But now these components of wellness, tracking of health parameters like steps taken and consequently getting discounts later on the renewal premium, using healthcare services like digital consultations, ordering medicines online, booking a test, sitting at home through the mobile app, all these, when it is delivered digitally to the younger and older generation both, they are finding it convenient, value accreting and useful, because otherwise health insurance, which was hospitalization centric, the chances of use was not very foreseen and people would wait for years and find lesser value. Now, it has enhanced the value of health insurance for masses as well today.
Dr. Manjunath, the unique power of AI is that not only it complements human skills, but also significantly expands the scope of human activity, ma'am. So some of the AI related technologies include, among others, like natural language processing, intelligent agents, computer vision, machine learning, expert system, chatbots, and voice recognition. So do you believe that there will come a time when the AI replaces human interference in healthcare systems?
I think, human beings are very precious to be replaced by machines, right? So that's always there. Having said that, in the rural areas where, there is absolutely no doctor available, definitely human, we can call it human robots or, robo doctors, whichever way you want to call it, we could have AI-based small tools which are enhancing the bandwidth and expertise of the ASHA workers. So she gets a bunch of tools which she can use to actually determine if this person is serious or not. So yes, the AI is making a decision there, and she is only mediating the communication with the end user. And to that extent, for triaging particularly, I think these tools can be super useful to identify people who need to be brought. Having said that, so overall in the scheme of things, I think AI will not be replacing doctors, but we all talk about in our community that doctors using AI may replace doctors not using AI, right? So that's sort of the tagline which we usually talk about, and we are seeing that trend. Every doctor is actually getting more and more accommodated, dependent on tools that will give a list of treatment options that they can choose from, and things like that, right? And then do an initial diagnosis, give some numbers. Based on that, we can actually determine, rather than just basing many of the decisions with just visual analysis, right? So we are seeing that trend happen. It's always human and machine working together to enable affordable, accessible care to everyone.
Yes, ma'am. And that's a very interesting insight that you have given, Dr. Manjunath. But Dr. Bhaktosh, continuing with the same question, I really want to understand from you, how are you leveraging big data, AI, ML, and other technology to enhance customer experience? Also, since processing of claims is a moment of truth for health insurance, so how are you using technology to reduce dependency on human intervention to save time during claim adjudication?
Technology for us and in general is in a continuum. So is the entire health insurance purchase to consumption process, and we have deployed various technologies at every touch point. For example, 90% of Niva Bupa's health policies are bought and sold through digital means on a tab or a mobile phone. Similarly, when it comes to claims, claims could be for hospitalization and non-hospitalization. On the non-hospitalization part, what we do is some of the statistics I told you about, digital consultations, more than 2,000 people doing that. 20,000 plus people book their test every month and increasingly through the mobile app every month. That's also a claim. Coming to hospitalization claims, what we have deployed is this is a much more sophisticated intelligence based system where we first digitize. Documents come in, let's say various formats like JPEG, PDF documents, they automatically get digitized into text, and we use intelligence, artificial intelligence to make sense of this, to decipher what is the diagnosis, what is the procedure, what were the symptoms, signs, etc. And then use fairly complex medical rules, product rules, tariff rules, etc. to automatically adjudicate claims. As we speak, 15% of our cashless claims are auto adjudicated, no human touch is required. 25% of our cashless claims we process in what we call as one touch, which requires a single touch. That means, unlike traditional cashless process that customer or the patient sends for cashless in the beginning and before discharge again the same process is repeated, in this case the first approval is the final approval, so the patients get to go home early. So what is happening as well is we are deploying the best of medical mind and other mind to do more complex cases, whereas artificial intelligence, machine learning is automating some of the little lesser complex claim processing. Not just that, we are deploying ML, machine learning and other technologies to detect fraud, which is a reality in health insurance, and pinpoint investigation to areas and cases where we need to investigate better. We do it also to recommend the right product or upgrade the right product when new products are available to consumers. For all of these, the continuum is from digitization, digitalization, using analytics and recommendation and processing, including robotic process automation. So this continuum is helping not just in one segment just of claims, but from a purchase to making outpatient claims, to inpatient claims, to any other process, cutting across the consumer journey.
Absolutely, and that makes the consumer's life more easy and more accessible, especially when it comes to healthcare. Dr. Bhaktosh, Dr. Manjunath, Dr. Srivastava, thank you very much for joining us here as we talk about the Indian healthcare system that has witnessed a paradigm shift in ensuring quality healthcare delivery to the systems and the citizens in the last decade. Increasingly, technology has been leveraged for a better reach and patient care. The application of digital technologies, including artificial intelligence, machine learning, data analytics, Internet of Things, and also cloud computing and robotics is also increasing in each facet of the healthcare system. This is a wrap for this episode. Thank you very much for watching.